Imagine waking up in the middle of the night with a familiar, annoying, burning sensation right in the center of your chest. You reach for an antacid, assuming it's just that heavy dinner acting up again. You swallow it, sit on the edge of your bed, and wait for the relief to kick in. But what if that burning isn't acid reflux at all? What if it is actually your heart, quietly sending out an urgent, desperate SOS signal, 48 hours before a major event happens? For millions of adults over the age of 60, this exact scenario happens every single day. We are taught to look for the classic, dramatic signs of a heart attack, like a sudden, crushing pain that makes someone clutch their chest and collapse. But the reality for older adults, especially women, is often completely different. It doesn't look like a movie. It looks like an everyday stomach ache. Today, we are going to look closely at a phenomenon doctors call a silent or atypical heart event. Your body is incredibly smart. It rarely shuts down out of nowhere without trying to warn you first. It throws up subtle smoke signals up to 2 days before the actual event hits. By the end of our conversation today, you will know the exact difference between ordinary, everyday indigestion and the hidden cardiac warning signs that look identical to it. More importantly, you will learn a simple, 3-step check you can do right from your living room chair to know if your stomach is acting up or if your heart needs immediate attention. As we get older, the way our bodies communicate changes. The nerve pathways that carry pain signals from our organs to our brain can become a bit crowded or dull. This is especially true if you manage conditions like high blood pressure or diabetes. Because those pain signals get blurred, a heart under stress can easily trick the brain into thinking the discomfort is coming from the stomach or the esophagus. In the medical community, missing these early signs is one of the most common reasons people delay getting help. But once you know what to look for, you can act with total confidence. Let's talk about the simple science behind why this happens, without any confusing medical jargon. Think of your heart as a house with its own plumbing system. Over decades, the pipes, which are your arteries, can naturally get a bit narrowed by plaque buildup. When a pipe becomes significantly narrowed, the heart muscle doesn't get quite enough oxygen-rich blood, especially when it's trying to work a little harder. In medicine, this lack of blood flow is called ischemia. Now, here is the trick. The nerves that supply the bottom part of your heart run right next to the nerves that supply your stomach and your esophagus. When the lower part of the heart lacks oxygen, it sends out a dull, burning distress signal. Because those nerves are bundled so closely together, your brain misinterprets the message and tells you, "Hey, we just have some bad stomach acid." It feels like a heavy, burning pressure right behind your breastbone. Why is recognizing this 48 hours ahead of time so incredibly important? Because time is quite literally muscle. When a heart attack actually hits, a blood clot completely blocks the pipe. But in those 2 days leading up to it, the pipe is usually just heavily restricted. The heart is struggling, but it hasn't sustained permanent damage yet. Catching the warning signs during this 48-hour window gives doctors the chance to clear the restriction safely, protecting your long-term independence, your mobility, and your peace of mind. Let me tell you about a patient named Margaret, a vibrant 67-year-old grandmother from Ohio. One Tuesday afternoon, Margaret felt a strange, burning heaviness in her upper stomach while working in her garden. She assumed it was heartburn from her lunch and took a couple of antacid tablets. The burning didn't completely go away, but it didn't get terrible either. She just felt strangely exhausted, so tired that she had to sit down and rest, which wasn't like her at all. Thankfully, her husband remembered that unusual fatigue paired with indigestion can be a hidden sign for women. He insisted they visit the local clinic. When they arrived, the team discovered that Margaret's main coronary artery was 95% blocked. Because they caught it early, doctors placed a tiny mesh tube called a stent into the artery, completely restoring her blood flow before any muscle damage could occur. Today, Margaret is right back in her garden, fully independent. So, how can you tell the difference between fake acid reflux and the real thing? Here is a simple check you can do. Step 1. Check for movement shifts. True acid reflux usually gets worse when you lie down flat on your back or bend over to pick something up, because stomach acid physically flows upward. If your burning sensation stays exactly the same whether you are sitting perfectly upright, standing, or walking, it might not be acid. Step 2. Look for the travel pattern. Ordinary heartburn stays localized in the chest or upper stomach. A heart warning sign often likes to travel. Pay close attention if that burning sensation starts to creep upward into your lower jaw, radiates into your neck, or moves into your left shoulder and arm. Step 3. Monitor for accompanying symptoms. Ask yourself, am I sweating for no reason? Or do I feel suddenly lightheaded or unusually short of breath? Real acid reflux will not make you break out in a cold, clammy sweat, nor will it make your legs feel weak. The biggest mistake people make is trying to tough it out or waiting until the next morning to see if the feeling passes. Many older adults worry about causing a scene, embarrassing themselves, or wasting a doctor's time over what might just be a piece of poorly digested food. Please remember, it is always vastly better to be told you have a simple case of indigestion at the clinic than to stay at home wishing you had gone. Never apologize for protecting your health. If you perform the living room check and notice the burning sensation traveling to your jaw or arm, if you are breaking out in a sweat, or if the pressure feels heavy, like an invisible weight sitting on your chest, do not drive yourself to the hospital. Call emergency services immediately. The paramedics can begin evaluating your heart right in your living room, saving vital minutes that protect your heart muscle. To wrap up our conversation today, let's remember the 3 main points. 1. A heart attack can look exactly like acid reflux 48 hours before it hits, especially in adults over 60. 2. If the burning sensation travels to your jaw, neck, or arm, or comes with unusual fatigue and sweating, it is an SOS signal from your heart. And 3. True heartburn changes when you change positions. A heart issue does not. Your health and independence are your greatest wealth, and listening to these quiet signals is how you protect them. I would love to hear from you in the comments below. Have you, or a loved one, ever experienced a health symptom that turned out to be something completely different? Sharing your story helps build our community's knowledge and might even save a life. If you found this information reassuring and helpful, please subscribe to the channel and share this video with a friend or family member who needs to hear it. Thank you for watching. Take gentle care of yourself, and I will see you in our next video.